an extra long weekend. I hope you had an extra good long weekend. For those of you who didn't, I hope it was still a good day. But I'm glad so many of you were able to join us on this adjusted schedule, recognizing the holiday. So have a really great call for you today. I'm glad to see everybody here. Just checking. I think we are waiting on. Oh, there's our speaker. Excellent. Okay, I'm just going to make. Keeps jumping around. There you are, Sabrina. I'm just going to make you a co-host. Wonderful. Okay, I think our waiting room has slowed down a little bit, so I think we will just get started. Again, welcome everyone to the October Food Security Community Call. We have a great annual discussion about the state of food insecurity in Montgomery County. I want to thank all of our speakers who are joining us here today from the Capital Area Food Bank, from DHHS's Community Action Agency, to talk about Capital Area Food Bank's 2024 Hunger Report and the 2023 Self-Sufficiency Standard for Montgomery County. So I think this will line up really nicely with the discussions we've been having recently about advocacy and the upcoming budget process for the county. So without further ado, I'm actually going to turn things over to Sabrina and Capital Area Food Bank to get us started on the 2024 Hunger Report. Sabrina, thanks so much for joining us.
Hi, everyone. It's so nice to be with you. I am Sabrina Tadele. I work at the Capital Area Food Bank, as Anne-Marie said. And yeah, I'm really pleased to be sharing this with you all today. I had the pleasure of meeting with Anne-Marie and her team early and talk about ways that we could pull some data from our study that's specific to Montgomery County. So I've tried to do that throughout this report. But if as I'm going through, you have any questions, or would like to see the data cut in a slightly different way, stop me, interrupt me, let me know. And if I can't answer it on the spot, I'll follow up and give you the answer after the call. So just a little bit about this report. We at the food bank have been doing this for 5 years now. Our goal in producing these is to offer insights on the landscape of food insecurity to the whole region and our whole community of stakeholders who are addressing this issue. And underlying these reports is original research that's done with our clients and the general population. And we, like I said, we publish these for all the stakeholders in our community to benefit from. Just a little bit on the methodology of the study. We partner with NORC at the University of Chicago, which is a wonderful organization that does this kind of work globally. And now that we've been doing this for 3 years with them, we have enough data to begin charting trends in the prevalence of food insecurity and other factors at play. And every time that we've done this in the last 3 years, it's been a general population survey, which means it is capturing a large enough sample to be representative of our region. And we actually, you can see the full N size right here is 3,800. We captured over 700 responses from Montgomery County alone. And so we have a large enough sample to say with confidence, this is what's going on with food insecurity in the county. For anyone who is really technical, we use the 18-item screener drafted by the USDA and tested many, many years running. So when we talk about the terms of food insecurity, we're using the exact same definitions as them. So the number one, by the way, Anne-Marie, I'm not watching the chats, but I am just seeing the little red number go high. So interrupt me if you see anything in the chat that I need to respond to.
No worries. Okay. Right now, we just have a bunch of folks introducing themselves, but we'll do.
Sounds great. Right. So key finding number one, the headline for the year really was that we saw a pretty significant increase in food insecurity. Like I said, third year we've done it, and it was looking pretty flat for between years one and two, but it's jumped from 32% to 37% for the region. And when we dive a little deeper and look at the county level, what's going on is a really wide range in terms of the prevalence of food insecurity. So, at the bottom of the pile in a positive way, is Arlington County, which still is 1 in 4 households, all the way up to 1 in 2 households, in Prince George's County, which is really just staggering. And for those of you who aren't familiar with the screener that we use here, the question is always, at least the STEM question is, in the last 12 months, have you da 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 da, all these different dimensions of food insecurity. So this doesn't mean that 50% of the population in Prince George's County was chronically, constantly food insecure, but that at some point in the 12 months preceding our survey, they were. Okay, and now this view is a little different. It breaks down the food security levels into the 4 statuses that you see on the right here. And I've kind of done a little call out for Montgomery County. So this is where you can see your numbers, where just a little off of half and half of the food insecure population splits between low food security and very low food security. You can see how that compares to the rest of the DMV. So naturally, the question is why? Thanks. It said the host muted you. I think that's probably an accident. The question is why? And the survey does way more than just ask about those 18 questions or those 18 experiences. We ask a lot of questions about people's household economics, their jobs, the types of trade-offs that they're experiencing. And we uncovered 3 key drivers of the increase in food insecurity. And I'll kind of take them one line at a time. The first one, which is no surprise to anyone, is inflation. The consumer price index. People are talking now about how year-over-year inflation is lower, but everybody knows that just means that it's rising at a lower rate. And so if you were to look at this cumulatively, like zoom out to 4 years from when our survey was administered, the cumulative growth in the CPI is almost 19%. And then if you go to this green line, the cumulative growth in average wages is only 7.5%. So you can just see right there, everybody on average has a lower purchasing power. And there was a long period of time after the pandemic where all sorts of different government programs were buffering people from these economic realities. And this orange line represents the average individual benefit in the SNAP program, so the average monthly allotment per person. And there, in the first 2 years, I guess, of the real spread between the black line and the green line, people had some kind of support if they were receiving SNAP, for example, to buffer them. But in the last 12 months, that's been gone as the emergency allotments ended. And so people, and it's not just this, right? Like there were eviction moratoria or stimulus checks or all kinds of things that we are now like our financial environment is completely devoid of those supports. And so people are completely exposed to the full gap between the cost of things and how much money they make. As I mentioned, we also asked about the trade-offs that people are experiencing between food and all kinds of other expenses. And this is the general population saying, my household has had to choose between paying for food and paying for this thing. So 33% of people said, yes, I had to choose at some point between paying for food and paying for something transportation related, or paying for food and paying my credit card bill. And I know that you all are focused on housing, and so I wanted to do a little bit of a deep dive into those issues specifically for your residents. The first thing that I found was 59% of food insecure residents in Montgomery County reported having to choose between food and their rent. or mortgage in the last 12 months. Separately, 58% of food insecure residents say that their financial situation has gotten worse in the last 12 months, and 50% of them, so 29% of all food insecure people in your county, are saying that my financial situation has gotten worse because of lost housing or housing costs increased. And they reported that as a major factor for their worsening finances. So I don't think that this is only an issue in Montgomery County, but this is certainly an issue. Okay, zooming back out to the whole DMV, it's really important to us to keep tabs on what's going on within the food insecure population, like how are the demographics shifting of this group over time. And so we look at a bunch of different dimensions of the composition of the group, and some of these are changing and some of them are not changing. And we also compare, right, between the food insecure and the food secure population. One thing that is not changing, this seems to be the same almost every year that we've asked it, is that the employment rate between these two groups is functionally the same. Food insecure people are working. If you strip out retired and disabled people from both groups, food insecure people are working at basically the same rate as the food secure population, which really points to the types of jobs that these people have, that they're working and food insecure. And then when we look at education, you would assume that the food secure population has a higher average level of educational attainment, which is true, but it's surprising to me that 29% of the food insecure population has a college degree, another 29% has some college, and this is something that's changing. The sum total of these two top categories is growing year over year. So more people who have higher education degrees are finding themselves in the food insecure category. This chart is a little complicated, so I'll break it down, but it's one of the most powerful findings and kind of shocking findings in the report. Last year, in 2023, we decided to stratify the population by their income level. So we spread them out into different income deciles. And that's the light orange bars. And then we looked at the prevalence of food insecurity at every income level. And our theory then was, certainly it's going to go down as income goes up, but I bet the shelf drop off is going to be much higher up the income spectrum than you would probably think. And that was true. I mean, we saw 1 in 5 households at the median income level. These are household incomes, by the way. I just want to stress they're not individual incomes. 1 in 5 households at the median income is food insecure in 2023. And that's a little less crazy when you think about the average living wage in this region, which is extremely high. It's $137,000, depending on what kind of resource you're consulting. So we've got a really high level of food insecurity higher up the income spectrum than you might think. But then when we added this year, so the dark orange bars, we noticed that the level of increase in these middle income categories is really sharp. I mean, the absolute numbers are obviously higher down here, but in the middle, we're seeing 22 to 36% or 21 to 31%. Again, right in what we would kind of consider the middle class. And this just really points to how economically squeezed people are feeling here in the middle and not just at the lower ends of the income spectrum. Looking at race, unfortunately, this is something that is persistently inequitable. We see rates of food insecurity that are 2 to 3 times higher among populations of color compared to the white population, which of course is due to centuries of systemic racism in our country. And knowing that you have a particular focus on newcomers specifically, but really everybody, I think, could benefit from being targeted as it comes to offering culturally familiar service to the people that are attending food distributions or anything else. I did a deep dive on the racial composition of this food insecure population. And I should say up top, we're slicing into pretty thin ends once you get down to this, because it's Montgomery County's food insecure population who identifies as fill in the blank race. And so these don't take these as gospel, but this is what we saw. The food insecure population in Montgomery County is about 1/3 Black, 1/3 Hispanic, and then maybe like a quarter white and a little less than a fifth some other race. Of the Black population, the majority identify as African American. That 31% chose other, which is some country other than everything else you see listed here. But then you have 9% from Nigeria, 8% from Ethiopia, a small percentage from Jamaica. We asked about people whose country of origin is Haiti, South Africa, Ghana, or Somalia. No one in Montgomery County chose those options. And then of those who identified as Hispanic, 33% say that their country of origin is El Salvador, 22% said some country in South America, 15% said some other Central American country, and then we have Mexico, Puerto Rico, Spain, other, and a couple other no responses. So, for what it's worth, these cultures can be quite different from each other. So this is a little bit of data that you have at your disposal. Now, we have a couple of cuts by age. This is the food insecure child population in Montgomery County. So 11% of children, which equals 27,000 children, are food insecure. And if you have in your mind the numbers for the region that I showed at the top of the presentation, you'll notice all of these are lower. And that's normal, mostly because parents will make personal sacrifices so that their children are food secure. So these numbers are almost, every time we've done this, they're the lower at the child level. Then at the other end of the age spectrum is older adults, which we defined as over the age of 60. 18% of Montgomery County residents over the age of 60 are food insecure, which equals 44,000 seniors. The last finding that I'll highlight is that over half of food insecure people are not accessing charitable food. We found this out for the first time last year, and we're really surprised by that number. And it went up this year. My hypothesis is because there's an influx of newly food insecure people into that total denominator, and less of them are already accessing charitable food. So now it was like 46% last year. Now it's 54%. And in Montgomery County specifically, it's a little lower than the regional average at 49%. And knowing that this was such a large group, we asked a lot of questions about what are the major reasons that people say they are not accessing charitable food. And this infographic on the right pictures some of those reasons. If we just put them in descending order, they happened to cluster into these kind of buckets. The top 3 reasons all relate to awareness. People said, I am not sure if I would qualify. I don't know when to go. I don't know where to go. The next one was, I can't go when food is being offered. And then the next little cluster, I see it in a family that I could call stigma. I don't want to share my personal information. I don't want other people to know I need help. I don't feel comfortable at food distributions. And these are all, different levels of difficult to address, but I think that some of them are more addressable than others, especially in the awareness category. That feels really solvable. So yeah, I just wanted to lift these up for people who work in this space, as these are the things that are keeping people from accessing charitable food. Oh yeah, this is it. That was my last finding. So I just have this Q&A slide, which I can hold here, or I can go back to any of the other slides if anyone has any questions.
So yes, please, if anyone has any questions, feel free to raise your hand or pose them in the chat. I'm happy to read them aloud. I am sure you have questions. Like Sabrina mentioned, she was kind enough to give myself and some other members of our staff, a preview of this presentation. And I really, really appreciate all of her work in kind of drilling down on Montgomery County specific numbers. So thank you so much for taking that extra step and sharing that with us. One question in the chat I see is, how large was the sample size and how were the participants contacted to participate in the survey?
Yeah, great question. So the overall sample is just under 4,000. The Montgomery County sample is just over 700. People were contacted via a paper mailing using an address-based sampling method, and we over index, we over mail in census tracts that have a low propensity to respond, which is usually lower income census tracts, just to make sure we're getting a truly representative sample. And we compensate everyone who completes the survey either $10 or $15, again, based on the kind of propensity to respond of that census tract. And then our friends at NORC did some really careful weighting to make sure that the samples that we collected were weighted according to the actual, a whole bunch of different factors for the population of that particular county. By the way, I failed to put a link to the full chat, to the full report in the chat. So I just did that now, but now I'm looking at a few other questions. Is SNAP considered separate from charitable food assistance? Yes, there was a different question for, are you receiving SNAP? Which I could get that for you if you want. This was, have you gone to a food pantry or other place that offers free groceries or meals or something like that? I can get you the exact wording of the question if you want. So those were asked separately. I can tell you the food insecure population accessing SNAP is even lower. And if you're curious, I might be able to pull it up really quick while we're talking. What does the food bank plan to do with this data? So much. I actually just had a long meeting with our director of analytics where we created a whole matrix of applications for the data. There's a ton of applications for us at the food bank. One, we try to target and balance our food distributions in proportion to the distribution of need across the region. So, trying to be equitable with the resources that we have and meet the distribution of the food insecure population where it is. Another one is there's a whole lot that can be done with the data we captured on what we're kind of calling the unreached food insecure and developing strategies to support them better. There were also tons of questions that were in the survey that I didn't talk about here, like what are the hours of operation that you would prefer? It wasn't asked exactly like that, but like, what's the ideal time for you to go to a food distribution, and trying to work with our network to meet the needs of people and the preferences of people so that that's not a barrier. Gosh, yeah, I could go on and on. There's so many implications, but the other one is just doing stuff like this, like making it available for everybody else. There's a lot of power in this information for advocacy. So yes, there's a lot that we do with this. The 18 items screener, yes, I'll just put a link to it in the chat.
And I will mention Capital Area Food Bank does have some recommendations that they were going to share as part of this presentation, but we actually asked them to hold off for the moment. We're going to have a discussion all together after we, hear this report and the self-sufficiency standard and talk together as a community. And so we wanted Sabrina to kind of share some of that information then, like while we're all, talking about our advocacy ideas. Before we get to I believe there's one other question in the chat. Jennifer, I did see your hand, so please feel free to come off mute.
Yeah, so the question I have is that middle income population that is experiencing food insecurity. Did you do any extra analysis of like some of the characteristics of that population? Like, is it the housing? What is it that's causing them to show up in the food insecure population? Or are they in the like what level of food insecurity are they experiencing? Because I think that's the group that I'm a food pantry director. We're partners with the food bank. So, and I think that's the group that would be the one that I can't explain to people, right? People understand the rest of who's food insecure. And it was really interesting listening to you because a lot of what I've been hypothesizing is what's going on is what showed up in your data. So that's actually really interesting. But I'm just curious, what information do you have? Have you done any deep dive? Are you planning to into that middle income group and what's really going on with them, since that's an somewhat unexpected group to be showing up in the data?
Yeah, that's such a good question. The way that I'll answer it is a little bit sideways. When we looked at who is not accessing charitable food, they fall into that middle income group. So they are higher income, more highly educated, less severely food insecure. And then less likely to be using charitable food. So I think it's people who may not even necessarily think of themselves as food insecure, but are contending with some of the realities of food insecurity. It may be more episodic or intermittent, but not chronic. And I think that because they're not eligible for these benefits from the government, right? They kind of don't have that network around them that says like, here's where you go to get help and what to do about it. I'm curious to hear from you if you think these are some of the people who are visiting your pantry, or if you think that they're kind of the unreached, which is my hypothesis, not exclusively, but that there's more unreached in that third of the income spectrum.
I'm gonna guess there's more unreached in that third of the income spectrum, just from the little I know about those. I mean, what we're asking people to come is about the number of people in the household, the number of kids and their zip code. So otherwise it's like observations and hypotheses about what else is going on in their lives. It's a little sticky. But what was interesting when you were talking about new people coming in, we ended up doing kind of 2 point in time surveys of people this year, about 6 months apart. And both times about 20 to 25% of people had never been to our pantry before. And at the last one, we asked whether they were going other places, and about 80 to 90% said that our pantry was the only one they were going to. So it was really interesting to hear what you were saying about the use of pantries and that kind of turnover, because it kind of matches what we found when we were talking to people. But yeah, my guess would be most of the people who are coming to our pantry are in the lower income brackets. We might get a few people every once in a while who are in a higher income bracket, and maybe just know like they see us open and they figure, hey, this would help. But I think for the most part, we're probably the lower group.
Yeah.
Thanks. Sabrina, there were still 2 questions in the chat. One, I know there's no concrete solution, but are there any ways to advise how to relieve or remove the stigma of utilizing these resources?
Yeah. I think that this is a really important and broad question. When I've talked with my kind of communications strategy people at the food bank, their suggestion has been that rather than trying to like convince people who don't think that they're food insecure that they are and that they should get help, or to make people who are unwilling to go willing to go, that's really hard to change those types of things. It would be easier to try to focus on resource awareness and then kind of couple that with the various messages that might help someone tilt into utilizing the resources. So for example, some kind of resource awareness campaign, like just text this number and you'll get 3, food pantries near you. Everybody needs help sometimes, or something like that. Or one of the things that we found under this idea of barriers was, it would really help me if there were people who looked like me and spoke my language at the food distribution that I go to. So even like the faces of people that you put up as saying, these are people who use this service. So there are a lot of things that go there. I think also in that family is like culturally familiar foods, forms and signs and languages that people speak. I think trauma-informed care training can be really powerful for staff and volunteers who work with people who are experiencing food insecurity. I think it just leads to a different kind of like environment of care. There's so many like sub-bullets under stigma. I think you would probably want to get specific to the community that you're serving to figure out what that is. Another one is just like people feeling safe that they're like the information that they're going to be asked for isn't going to be used in any particular way, etc. So yes, I agree. No concrete solution. I think lots of like micro strategies under stigma.
Yeah. How are people defined as food insecure in this report?
Yeah, that's a great question. Click the link that starts with ers.usda, and that's the definition. It's an 18-question screener that's like experiential. Have you ever had this sometimes, often, never, those types of questions. And then depending on how many times you say yes, you're given a point score, and then those points are sorted into 4 tiers of severity of food insecurity, starting with food secure, totally food secure at the top.
First of all, thanks to Robert Fick for sharing that they do an annual client survey, and they have also seen somewhat of a rise in the average incomes over time. So again, just a little confirmation there. And thanks, Joe, for sharing about what's happening right here in Montgomery County with the MC Groceries program. To Stephen's point about there being some political chatter about the cost of living, the cost of groceries, but little focused discussion about food insecurity per se and its dimensions. How can we elevate the discussion around evidence-based factors in food policy? So yes, there have definitely been some programs rolling out from Montgomery County, particularly the Office of Food Systems Resilience, that are trying to address that in a variety of ways, including the latest, the MC Groceries program. And lastly, Christina, I wonder if those in the middle income bracket are thinking that they won't qualify for services, so don't even bother looking for them.
I mean, that was the #1 barrier that people reported, is I don't think I would qualify. And that's probably just, a stereotype or an assumption about what these places require for service. I mean, most of the pantries that I've ever been to don't say, if you make this much money, you can't get help. Most places don't ask that. Obviously, if you're dealing with like government commodities, it's a little bit different. But yeah, I think that is a major factor for a lot of people, especially the people in the middle.
Yeah. That is a perfect segue, I think, into our next presentation on the self-sufficiency standard. And we are thankful today to be joined by Leah Goldfine and Monica Goldberg from the Community Action Agency to talk about that report. And like I said, we'll come back together as a community, kind of answer any questions about that, and then really talk about what we've learned kind of, from both of these reports in conjunction. So thanks, everyone. Thanks, Leah.
Hi, everyone. I'm Leah Goldfine. I'm a program manager with the Community Action Agency. And thank you so much to the Food Council for inviting Monica and myself to speak with you today about a tool that we really like and hope that you'll find very useful as well. I'm going to go ahead and share my screen. We have a presentation to share with you about the self-sufficiency standard. So just give me one moment here. Computer's a little slow today.
My screen has been a little slow too, and we're in the same office. I'll go.
Yep, we are one office apart here at Community Action, Monica and myself.
I can hear Leah through the wall right now.
Yep.
We will not let us distract that. I'll just go ahead and introduce myself. So I'm Monica Goldberg. I'm a program manager with Community Action Agency as well. You all probably know me because I also head up the navigation team that are at some of our food sites. I'm also on the Montgomery County Food Council as a council member. So we're in a lot of the same shared spaces, but today we're going to be talking a little bit about the self-sufficiency standard. But before we do that, Leah, if you could, the next slide, we're going to do a quick introduction of Community Action Agency. If you guys don't know about Community Action Agency, we are the federally designated anti-poverty administration in Montgomery County. We are located or embedded, as I like to say, in the Department of Health and Human Services under the Office of Community Affairs. Community Affairs houses our health initiatives, so the Latino Health Initiative, the Asian American Health Initiative, the African American Health Initiative as well. If you're familiar with some of those programs that probably come out to your sites as well. Our mission really is to uplift people out of poverty. It's to advance social and economic mobility through an equity lens, through our services and partnerships and our advocacy. It's really, really a wonderful organization that we get to head up, and our programs include the navigation team, which I'm a head of, the Test Community Action Center, that if you've been to Silver Spring, you probably know it. We also have our VITA free tax program, our contracts and grant monitoring. If some of you know IZOT, and I think Melissa is on the call also, they're a part of community action. And we are also the Head Start grantee, which kind of think of that as that we get to hold and house Head Start with us. And we are the MCPS is the delegate of that grant. Thanks. Next slide, I'm going to hand it over to Leah.
So I am the staff liaison to the Community Action Board, and I just briefly wanted to mention the work of our board. I see Mary Bennett, one of our former board members, on the meeting today, so that's exciting. So the board is the governing body for the Community Action Agency and for the Head Start program, along with the Head Start Parent Policy Council. Our board, it's a very active board that engages in a lot of advocacy work at all levels. And they're really focused on issues that impact lower income county residents. They also plan and lead the Community Advocacy Institute, which is a free advocacy training program for lower income county residents. And I definitely wanted to mention that because I know we've had some graduates like Vanessa Pierre, who's been involved with the Food Council as well. So what is the self-sufficiency standard? The standard was created by the Center for Women's Welfare at the University of Washington School of Social Work, and it describes how much income families of various sizes and compositions need to make ends meet without public or private assistance in a specific geographic area. It was developed 27 years ago, and it is now calculated in 719 different family types for each county and area in a given state. The standard has been calculated in 41 states so far, along with Washington, D.C. and New York City. And this is really important to note because that allows for comparison between different geographic areas. Sorry, I need to move something off my screen. It is a measure of income adequacy based on the cost of necessities for working families, such as housing, childcare, food, healthcare, transportation, and miscellaneous items, as well as the cost of taxes and the impact of tax credits. The self-sufficiency standard is focused on families with working adults. So it assumes that the adults in the household are working full-time. And it's a measure of basic necessities only. So there's no room for, trips to the movies, dinners out at a restaurant, or anything like that. It is just a bare bones budget that focuses on housing, food, childcare, transportation, taxes, and miscellaneous items, as I mentioned before. It's set at a minimally adequate level using government set levels such as fair market rent and childcare subsidy levels. As I mentioned before, it varies by family type. So the self-sufficiency standard actually changes as children grow up. The cost of childcare for an infant is much more expensive than it is for a school-age child who just needs after-school care. And of course, very important, geographically specific at the county and in some cases at the city level when there is enough data for that level of detail. I just wanted to note that one of the things I like about the self-sufficiency standard is the fact that it is geographically specific. I've seen a lot of other measures out there that are regional, and it's sometimes hard to find information that is specific to Montgomery County. But we're fortunate that we have this tool that can be really useful when you're looking at the needs right here in our local community. I'm going to turn it back over to Monica.
Okay, so how does the standard compare? If you guys are familiar with what we would call an FPL, or the federal poverty line, that is based on the federal poverty measure, which only takes into account food and then other like extraneous expenses that are not labeled in there. If you've ever tried to pre-qualify someone for SNAP because you're like, oh, this person's a little bit close, maybe their SNAP is a little bit more, their FPL for SNAP is 130%. You've probably looked at that tiny little standard and gone through it to see where your family ends up. So the and that federal poverty level is also about 50 years old, 5 decades, over 5 decades old. So it's not exactly measuring up in the same way that the self-sufficiency standard does, which takes into account, if you can see the wheel here, housing, childcare, which you can see takes up a huge expense here, food, which you can see the difference between the federal poverty measure versus the one that is shown on the self-sufficiency standard. It's looking like 1/3 of the income or of for people's income and expenses are going to food, when actuality, you can tell in the self-sufficiency standard, it's much smaller and normally ranges from anywhere from 10 to 20%, with a median of 15. You also see that healthcare is also measured, clothing, but again, as Leah mentioned, this is very bare bones. There's no additional expenses, no, going out to eat or going out to see a movie or anything like that. So yeah, this is really the difference between, we have a much more comprehensive view of what the expenses are in a household, and you can see the giant jump that we get from 3,291 to $11,526 that are needed, right? And these are based off of the minimum wage as well, which in Montgomery County is currently, it's different. It was measured at this point in time at $16 and something, and is now $17.15, I believe. And Leah, you can correct me with those numbers because I know that you know them much more than I do. So yeah, and then of course the federal minimum wage is just the $7.15, which is atrocious. Next slide. Okay, and you can see that the self-sufficiency standard, it actually is going to break it down for you via county by county, and you can see that Montgomery County and Howard County are the highest cost of living here, with needing to have $43 to $45 an hour, which averages out to about $84,000 a year. So you need at least $84,000 a year to be one adult and one preschooler in a household. So the self-sufficiency standard is also going to be able to calculate for your family size and household, and even to the age, right? Because if you're thinking about that childcare cost, that's going to vary as a child ages from when they are newly born. But if you're thinking to yourself right now, I don't even make $84,000, how are our clients doing this? This is going to account for that increase that we saw from Sabrina mentioning, that there was the food insecurity in the middle class, right? That's because people do not make enough money in Montgomery County to be able to live within just the self-sufficiency standard. Next page or slide, sorry. Okay, so again, like I mentioned before, the self-sufficiency standard is going to be adjustable based on your family calculation. You can change it from one adult, which you see that the cost of living is going to be lower. They only need that $22.39 an hour, versus this last family at the end over here, which is 2 adults, 1 infant, 1 preschooler, and 1 school age. And you might be thinking, why is this different than this family in the middle over here that has just 3 people in there? And again, this is because the childcare costs are astronomical in Montgomery County and nationwide. As they measure up to food, they're going to be about 30% of someone's income at any given time throughout that child's life, versus food, again, that's going to be about that 10 to 20% of the income. Next slide. Okay. And then here you can see the different breakdowns of the actual income and those percentages that I was talking about. So you can see for just 2 adults, the most expensive part of their house is going to be their housing costs. 14% is for food, 7% transportation, 14% healthcare, 9% miscellaneous, and then 24% comes out in taxes, which we all know and cannot stand. But if you do need your taxes done, again, here's our plug for our free VITA tax program. I'm sure they'll be here in the new tax year to talk a little bit about it as well. But you can see again, that increasing, right? When our children are a little bit older, old enough to need to be out of the house so that we can return to work, it's that 30% cost for childcare. which is interesting. And I was looking a little bit at this earlier today, the 31% housing cost versus the 17%. And this is probably because people have moved into home ownership and it's a little bit more cost effective, but the childcare has gone up an insane amount. And then again, when you've got 2 adults and 1 school-aged and 1 teenager, that childcare cost is going to be a lot less expensive because they are in school full-time. They can probably stay home by themselves. But yeah, you can see the breakdown here in the way that the self-sufficiency standard is broken up. And this is something that you can share with your clients. And Leah is going to elaborate a little bit more on what the self-sufficiency standard can be used for. But when you're talking to your clients and your families and they're feeling that squeeze, this is something that we pull up and we talk to them about and say, like, listen, this is how your income is being broken down, how it should look, what the expectation is. And they can understand. And even if, right, they may not be making that $12,000 a month or $8,000 a month, it is reasonable for them to then access these programs and can deal with kind of that stigma to show, like, not everyone, we're not all on the same page. So what can we do to get you to be able to access services to make sure that you're able to eliminate some of these costs? Next slide. Okay. And how does the, oh, is it still me? It is still me. Okay. Sorry. So how does the self-sufficiency standard compare? Again, this is just a little bit of a look at the federal poverty level, the Montgomery County minimum wage. Again, this took a look at the Montgomery County minimum wage last year. Our board did advocate a lot for the increase in the minimum wage in Montgomery County. But as you can see, as it compares to the self-sufficiency wage, what is actually needed for this 1 parent, 1 school-aged, and 1 child that is not school-aged, you need a lot more. And that's something that our board, when they advocate for the raising the minimum wage, something that they bring to the table as well. So this is a great way to show what our advocacy should be using, because the standard of living is clearly much higher than what our minimum wage is. Next slide. Okay. Then strategies to help meet the standards. So again, when we were talking about what we use this for, at least in my department, and what we are actually talking to our clients about, there are a lot of different supports. SNAP is one of them, right? These food pantry assistance. How can we get that 10 to 20% of food down to 0, right? SNAP is obviously a supplemental nutritional assistance program. So how can we meet those other needs, whether it's through advocacy, whether it's through connecting families with food stamps, trying to overcome those barriers, whether they're tech barriers, transportation, or just knowledge gaps. Then we've also got our child care scholarship program. Sorry, I almost called it the subsidy. Which you can help people apply for. That'll cover a large portion of their childcare costs, which I know some of you are probably thinking, oh my God, that childcare scholarship application is a beast and I don't want to do it. I know, but guess what? The county has a program that assists people to help that. Navigation also helps with applying for that. And then you've also got, healthcare, Medicaid, the child tax credits, making sure that people are doing their taxes and getting those benefits that they really, really are entitled to and need, can help offset some of these costs of living and help them get to self-sufficiency. Next slide. Now handing it over back to Leah.
Thanks, Monica. So one of the best ways to help families get to the self-sufficiency standard is to raise wages, raise their income. Our board is focused on this issue by advocating for increasing the minimum wage. And, as Monica noted, our board definitely acknowledges that we are very fortunate to have a higher minimum wage in Montgomery County than in most parts of the country. But at the same time, it's nowhere near the self-sufficiency standard. Someone working at minimum wage would still need some help to purchase their basic necessities. And we try to emphasize that. Of course, support for living wages. Unions can help to increase wages in different industries. Increasing benefits. This has been another advocacy issue for our board. Paid sick leave, holidays, paid family leave, health insurance, pay equity, anti-discrimination laws, increasing and improving education and training, and then economic justice policies such as ban the box, which we do have in Montgomery County. And this is a law that prohibits asking about criminal history for most job applications. So there are a lot of different ways to use the self-sufficiency standard. Of course, I've talked a lot about using it as an advocacy tool because this is the primary way that our board uses the self-sufficiency standard. They actually reference the self-sufficiency standard every time they testify on a particular bill. And that's because it's relevant for pretty much any issue you can think of that impacts lower income county residents. It's used to explain why the cost of living is so high in Montgomery County and why a certain policy is needed. It can also be used for direct work with clients. I think Monica mentioned this a little bit, and she was actually just telling me recently how she's been having our navigators use the self-sufficiency standard in their direct work with clients. Certainly for grant writing, it is a very, very useful tool when, again, trying to show the very high cost of living here in Montgomery County and why additional funding is needed for various programs. Setting eligibility levels for certain programs, benchmarking and evaluation of services. I've also heard of some, very specific examples of how this self-sufficiency standard is used. Just to name a couple, we have a former board member who works at the Housing Opportunities Commission, and she told me that they use the self-sufficiency standard to train new social work interns because they may be coming from other areas and not as familiar with Montgomery County. And it's a good way to explain, why there are so many challenges for county residents and why it's so expensive to live in this area. The same board member actually told me that they also use the self-sufficiency standard for an activity that they do with HOC families called the Reality Store, where participants go through exercises to learn about various costs and the wages that they would need in order to actually reach the self-sufficiency standard. I also wanted to know, just in terms of, direct work with clients and, for anyone who's working with folks who are, trying to find employment, the full report does provide a summary of the top professions in our area and then looks at which of these professions offer an average wage that is high enough to get to the self-sufficiency standard. So it can also be, a training tool in that regard as well. So the full self-sufficiency standard report can be downloaded right from our website. There's also a summary that might be helpful if you're wanting to share this with your staff. I also just wanted to highlight a few things that are included in the full report that are kind of special to Montgomery County. The narrative portions of the report go into a lot more detail about some of these programs, and I would encourage you to take a closer look. So the report does include the Guaranteed Income Pilot Program, which I believe just wrapped up, the Working Families Income Supplement, which is our local tax supplement that matches a portion of the state earned income tax credit. It also discusses the Early Care and Education Initiative Action Plan, Montgomery Cares and Care for Kids, two important programs, and then also financial empowerment centers and our own volunteer income tax assistance program, really highlighting how these types of services can help people get to the self-sufficiency standard. So I am going to stop my screen share for just a moment here, and I'm going to very, very briefly, if time permitting, just show the interactive tool, just to give you a sense of what that looks like, because I think this can also be very helpful. So this is also available on our website. This is an interactive version of the self-sufficiency standard where you can actually see how many people in Montgomery County are living below the self-sufficiency standard based on different demographics. I'll also note that there is a state level interactive self-sufficiency standard that our state association, the Maryland Community Action Partnership, put together. And that is also a really useful tool because you can compare the self-sufficiency standard here in Montgomery County with other parts of the state of Maryland. So the tool includes some instructions at the beginning, an overview of what the self-sufficiency standard is, some instructions on just how to use the interactive tool. I'm going to go to this self-sufficiency standard by family type. So as you can see, this is a good way to figure out what the self-sufficiency standard would be for a certain family composition. You can change the number of adults in the household. Let's say this is a 2-adult household with 1 infant and one school-age child. And it's going to change based on the dynamics of that specific family, the expenses that that specific family would encounter. So you can see, of course, childcare, $2,845 a month, very, very high, even higher than their housing costs because of that, very high cost of infant childcare. But it does also include, certain tax credits that this family might be eligible for, and then goes into some details about what the hourly self-sufficiency wage would be for this family, for each adult in the household, and the monthly self-sufficiency wage, and then the annual self-sufficiency wage, which is $125,000 and $125,962. And this adjusts, of course, based on the family structure that you select. There's a tab here that compares the self-sufficiency standard to other measures. I really like this tab because it really gets at the heart of the issue of why it's so expensive to live in this county. You look at what we're saying is the minimum wage, which again, to emphasize, we're very fortunate to have a much higher minimum wage in Montgomery County, but at the same time, it is not nearly enough. It's nowhere near the self-sufficiency standard. And this can be adjusted again based on the structure and composition of the household. So the self-sufficiency standard comparison by geography looks at, comparing our self-sufficiency standard to that of other parts of Maryland. If you look at the statewide self-sufficiency standard tool that I mentioned earlier, that does go into a little bit more detail, comparing different geographic areas of the state. And I think this can be certainly useful when applying for different grants and things like that, because it really shows why it really shows just how expensive it is to live in this part of the state. We have a list of all of the different sort of most common occupations in the area, and you can again adjust for a certain family structure and see which occupations actually fall above the self-sufficiency standard and which fall below on average. For a certain family structure. This can be a very helpful tool, working directly with clients in coaching settings, things like that. And then last but not least, the self-sufficiency standard by demographics. So this is incredibly helpful because it can show the breakdown of how many people are above and below the self-sufficiency standard based on different measures or different demographics. So here we've got age, for example, 39% of 25 to 34-year-olds are below the standard. For 35 to 44, it's 34%, and continues to go down, as the population ages. There are many, many different demographic breakdowns that you can choose from. We can look at gender, for example. Pull this down. We've got, the comparison for women, 35% under the standard, whereas it's only 31% for men. And I'm not going to go through all the different categories here, but I would encourage everyone to really explore this tool because it's very eye-opening. It can be helpful when, engaging in any sort of advocacy work, or as I mentioned earlier, the grant writing, or really however you're using the tool. This is a good way to get a better sense of how many people are actually below the self-sufficiency standard. I am going to stop my screen share, and then I'm going to put this link in the chat. I'm going to put a couple links in the chat actually, so that you can, take a look at all these tools later on. And we are more than happy to, answer any questions that anyone may have.
Thank you so much, Leah and Monica. What are our questions about the self-sufficiency standard? And I will be sure to share any links in the chat along with our follow-up resource email. So don't worry if you don't catch them here. Dana, I saw you come off camera. Did you have, nope, just just showing us you're present. I appreciate that as well.
The link that I just put in the chat, that is our self-sufficiency standard webpage. You can download the full report along with the summary report. And we do have a small number of printed copies if you happen to need a, a printed copy for your team, but just let us know.
I know that was a lot of information to process and think through. So happy to give everyone just another minute to kind of collect thoughts. And if there aren't any questions for Leah or Monica, oh, sorry, there we go, Sabrina, great, thank you. What are some of the distinctions between the MIT living wage calculator and this one?
That's a good question. I'm not as familiar with the MIT living wage calculator. I know that there are also a couple others. United Way has Alice, and I know there are other organizations that have come up with kind of similar tools. I will say that the self-sufficiency standard goes into a lot more detail in terms of breaking down different family compositions and going down to the level of, the age of the children in a household. And I don't think any of the other measures do measure quite at that level.
It's not as interactive also, like if you're looking at the MIT one, and just from my experience past, you can't really play with so much. It's like a set guideline. Whereas with ours, you can really plug in and customize it to the families that you're working with. And it's really, really useful. Like Leah had mentioned, like we've used it with our opportunity coach program for when we're talking to our families about wanting to, lift out of poverty and really make a difference with their income and their choices and what they're going to prioritize. It's a great tool for them to actually be able to see, especially when their children are aging. Like, what could I possibly be doing right now to prepare for when my child does enter maybe elementary school? Should I go back to school then? So that would be the most guidance. That the self-sufficiency standard is a little more interactive in that way.
Okay, two other questions in the chat. Does the full report describe what is included in the self-sufficiency standard categories? For example, does healthcare include premiums for people who have insurance through their work?
Great question. The full report does describe in detail where all of the numbers come from for all of the different categories that are measured. And for health insurance, it does assume employer-sponsored healthcare.
Okay. And how is this being used in developing the county budget for services?
Well, another great question. I don't know that how it's being used, directly to develop the county budget. I will say, obviously our board uses it to advocate for certain budget items and changes to the budget and programs that we think, might need a little more funding. But I will say that we have done presentations for the county executive, for the county council members as well, along with other, leaders in the county. So our hope is that it is, part of that thought process that goes into developing the county budget. But I'm not sure how it's being used directly to to develop the county budget.
All right. Anyone else? Any questions before we move on to a few minutes of conversation? Okay. Feel free to keep adding them to the chat, and we will, if for some reason our speakers need to leave before we get to them, we will be sure to follow up with that. But thank you so much again, Sabrina, Leah, Monica, so much information to really support the process that is going on right now with the county budgets. I thank those of you who have shared already, but if there are other food assistance providers on this call that would like to kind of speak to, whether or not this reflects what you are seeing on the ground, how this information might support your efforts, things you want to consider advocating about during the budget process. We're happy to make some time here to talk about that. And again, I know there's some thoughts. Dana, please.
Thanks for both presentations, and I will just say that absolutely echoes what we're seeing at with Mid-County United Ministries. One thing I guess I was curious on, that kind of going back to the Capillary Food Bank one, but also even thinking about this is, we have a lot of seniors who are on fixed incomes and who's clearly are not, their incomes are not increasing according to inflation ways. And so, and just curious if that's something that you're seeing more in that how that may have come out in Capillary Food Bank. And what I absolutely, I mean, so many of the people that we're seeing are working, and how we can educate people and our council members on, using this data, because it's really powerful to show the complexity and also how many people are being affected. And yeah, just kind of curious if there's anything in here also particularly, I know a lot of your presentation is focused on people with children, but people in later in life, the skew for healthcare costs are so much higher. Just curious if some of that comes out in the data.
I'll just jump in really quickly to say that the self-sufficiency standard that we presented today is for specifically focused on like working age adults. There is a separate self-sufficiency standard that the University of Washington has developed that's specifically for seniors, though. We don't have that report for Montgomery County, but that is something that you could check out on their website. They have a lot of information available there.
Yeah, I would just echo everything that you said. I think this is a particularly vulnerable population. And, the rate of food insecurity for seniors compared to the general population is lower, but it's still really high. And so, as it relates to advocating for this population, I think that both, data sets that we've heard about today offer helpful information. And I think that to the extent possible, increasing public resources for seniors where, like you said, income generated from work probably isn't going to be a factor is the strategy that I would recommend.
I think maybe also, and this could be like on a programmatic level, I know that the county focuses a lot on unduplicated data. But something that we've been looking at is in our seniors, why is it that there's so much duplication? And that's because their need never goes away, right? Because they don't have children that are aging out of childcare, going into schools. They don't have, they're not accessing education to get better jobs because they're living on this fixed income. So that might be something to focus on in your own reporting of, are your seniors those duplicated residents that are coming back every single month because they need this, because they are on fixed incomes, and because there's not an expectation of loss of childcare or gaining in some sort of, other income. So that's just something to maybe think about, because we're doing that on our end as to why we're seeing seniors so often, and the same seniors as well. And that's what we're finding. It's, kind of like this thing that we're not talking about, that they're not going to be gaining any more income.
One other thought on seniors, there's a pretty sizable senior population that is caregiving for children. It could be that the parents of those children are incarcerated or not well for any other reason, or just financially unable to support. In those cases, which is the minority of the time, but it's still enough that we call them grand families, not that we came up with that term, but making sure that those households are connected with all of the same resources that are traditionally targeted towards parents.
Thanks again. I am gonna in a minute, I'm going to run just a quick poll on today's call. Sabrina, I know that you are traveling right now, so I don't want to put you on the spot, but if you either had something quick and easy to share, or if you wanted to send me a follow-up email and I could include it in our follow-up resource email to attendees about some of the policy recommendations that Capital Area Food Bank has created in response to the hunger report. Happy to give you, a couple of minutes now. Like I said, if it doesn't really work for you travel-wise, we can share that out after.
No, I'm happy to. I won't be able to pull up my slide, but also my colleague Joe is on the line, and he is our director of advocacy and public policy and can speak to those issues. But I would just highlight, especially because we talked about workforce solutions a few times, one of the things that we lift up in the report is that there are so many amazing workforce development programs in our region, but not enough of them are accompanied by a substantive wraparound services strategy that have some of their basic needs kind of supported or ensured while they are training to take a different job. Because for so many people, the amount of kind of financial destabilization that it would require to do some of these courses, even if it's just a 6-month program, like they don't have the financial wherewithal to pause or reduce generating an income for 6 months so that they could earn maybe 20 or 30% more. So that's really important. That's really near and dear to my heart. That's some of the work that I lead at the food bank. And so not to put Joe on the spot, but also welcome his participation on our advocacy priorities.
Yeah, Joe, if you're able to come off mute and on camera, we're happy. Oh, there you are, Joe. And also pleased to introduce yourself, because I know you're relatively new with Capital Area Food Bank, and I think this is the first time introducing you on one of our calls. So welcome.
Thank you. I'm happy to join you all and appreciate both of the great presentations. I think in terms of our agenda looking forward, the Maryland budget's been tight. It's been in sort of under long-term structural pressures. But the good news is there's $500 million in unallocated funding at the state level for this current fiscal year. So there will be a little bit of a cushion as the governor addresses the structural budget issues, some hard choices, whether for revenue measures, and a lot of that's going to depend on what happens in November, where that direction is, and where the federal funding is, both in terms of the continuing resolution, the potential government shutdown as we get closer to Christmas. So a lot of big ifs, but I think the big sort of tentpole agenda items we've had are going to remain. And those will be trying to figure out ways to improve SNAP, boost SNAP, ways to get universal school meals in place. So I don't think there'll be anything that's a deep surprise to anybody here. It's the things that we've focused on together over the years, and looking for opportunities where we can sort of squeeze through the budget straits and try to get something over the finish line.
Thank you. I am going to share a quick poll. We're then going to be joined by Heather Bruskin and and OFSR with some updates. But I did also want to put in a plug. We're going to share some dates in the chat of some of our upcoming meetings and events. And Joe, your reminder about the state budget and that system coming up is a good tag to, again, be joining us for our food system advocacy calls, especially as we go into that state legislative session. And this will be a good subject to kind of pick up as we, start with the county budget, and then we start looking at state programs and where these can all connect. So I am going to run my poll. And if everyone would be so kind as to just answer a few brief questions about today's call. And then again, thank you so much to our speakers for joining us. And I will turn things over to Heather Bruskin to share some updates at OFSR. Welcome.
Thanks so much, Anne Marie. It's terrific to be with all of you this afternoon. So yeah, I just wanted on behalf, I think I know most of the folks here, but in case we haven't met before, I'm Heather Bruskin. I'm with the Office of Food Systems Resilience in Montgomery County Government. I think my colleague Juan Cruz might be on, but we've been covering a variety of meetings and commitments today. So, but Anne Marie was gracious enough to invite us to share a little bit of information about some of the things that we've been working on, and as always, hopefully be available in case there are questions or feedback that you all would like to share. So the three main things that we wanted to do was just kind of let you all know where the community food assistance grants are in that process, because that is certainly something that has been top of mind, I think, for a lot of our food assistance provider partners. For those of you who aren't aware, this is kind of the major post-pandemic funding strategy transition for county government in terms of how public resources are allocated to food assistance provider partners. And so that application process closed recently, and the applications went through initial screening and are in the final stages of being reviewed by our volunteer reviewers, who are terrific and much appreciated if any of you are on here. It does take a lot of time to go through those, and wanted to just express huge appreciation to all of you who submitted applications for the time that you invested in that process. I know that it is a major transition, but with public dollars being limited in availability, and it's a big point of shift for our entire system. We really tried to only ask the questions that we absolutely needed to, but our hope is that this will give us a lot of information that will really be critical in shaping the long-term strategy and investments of the county in this space. So our hope is that we, by the end of this week, can start to look at all of the reviews and the scores that have come through to start making funding recommendation. And as you might imagine with county government, there's a number of steps in the review and approval process, but we hope that we will be getting back to applicants soon with news on the outcome of the process. So any comments or questions, please feel free to pop them in the chat box and I'll take a look after. The second update, Juan, did you want to talk about the FAP survey and what's coming down the pike there?
Yeah, absolutely. Hello, everyone. My name is Juan Cruz. I am the Performance Management and Data Analyst for the Office of Food Systems Resilience. If you remember, about a year ago, maybe some of you completed the Food Assistance Provider Survey. This was a survey that asked about your funding streams, about your staffing, your data capacity, and all other types of things. We see this as basically like a food assistance census in a way, because it gives us a snapshot of where the status of a lot of our partners. And so we're leveraging the Community Food Assistance Grant so that because in there, most of you that applied have already filled in some of the same information. So we would hate to ask the same information of you twice. And so we're working with the Office of Grants Management to be able to, be able to only ask those questions that we need from those that have applied. And so we are, we have planned we have planned and tweaked the questions, and we are hoping to communicate for you all a date for the release of the survey, potentially sometime in November. So we want to just to give you a heads up, and obviously if anything comes to mind from last year, and if you have any feedback, please don't hesitate to reach us, reach myself. I'll put my email in the chat, and we welcome any feedback on it.
Thanks, Juan. And then the last piece of information that we wanted to share as an update is also letting you know about some of our upcoming grant programs. So we have in addition to the school-based food assistance grants, which that program has already kind of run and the awards have been announced for this year. We also have our food as medicine grants. And so this will be the second round of these funds. They were initially supported through the special appropriation last year. And so we're about the midway point with a lot of those current year grants. But the next iteration of the program will launch, we anticipate, in January. And so again, that will be through the Office of Grants Management. And so if you haven't already, please sign up for their newsletters because that shares a lot of information, not just on our grants that are coming out, but other county grants, as well as private sector grants, which are also probably relevant to your programs. And then, so that will be probably in January with the goal of having money out the door by early March. And then we also will have our FY25 SNAP outreach grants. And so those will launch probably in March. So the goal is to stagger our programs a little bit more over the course of FY25, as opposed to last year when they all pretty much came out at the same time. So in hopefully a little bit of grace to all of us, we hope that they'll be strategically rolling out over the course of the year. So I don't see any questions, but thanks for the chance to be here with all of you. It's nice to see you. Thanks, Anne-Marie.
Thank you. Again, any questions for OFSR? If you think of any in a few minutes, feel free to put those in the chat. I did just want to make note of 2 items with November. Again, our November call is falling on what is another holiday. If we follow our regular schedule of the second Monday of the month, that would be Veterans Day. So we are probably going to shift again to the following day, to that Tuesday for our November call. I will send out registration information when we send out the follow-up email from this call. I did also want to mention with November coming, those of you that are participating in the holiday giving program in the county, I just wanted to make space here for a couple of minutes. I know that there have been changes made in terms of the support that has been traditionally provided from the county in supporting that program. You know, that there's kind of more going on now in providers' hands in managing lists and recipients. And, you know, I don't know, Pat, if you or anyone else who's been participating has any updates to share, because I feel like kind of challenges with that may, you know, have an impact on the rest of the community in terms of families that might slip through the cracks in getting served that would traditionally be served through the holiday giving program, if there's just information that other providers should be aware of.
Well, I did miss the call that they had, and I haven't had a minute to catch up on it. But I do know there's significant cuts in the support base with the database, et cetera, and tracking. So I really wish I could help you on that, but I just got to read the email that they sent with the information because we weren't able to have a rep on that day as well. Several of us were out.
Yeah, and I apologize. I couldn't make that meeting either. I made
the challenging, I know, but in some ways I'm sort of looking forward to some of it because there's sometimes overlap in situations, et cetera. The reporting pieces, we could just do that individually. So I do miss that piece where they, you know, would do the overlap with us so we know who everybody else is serving. But I know they did send an email. They had a call about 2 weeks ago. But check your email if you're a holiday giving provider. I'm really sorry. I can't provide much this time.
No worries. Is there anyone else on the call that normally supports that program who attended the most recent meeting? Seems not. Again, I guess just for those of you that don't normally participate, just know that there may be some families where, like I said, there may be some confusion in the space this year. And so you may have families who have normally been served by that program for holiday foods that may now be seeking other resources in the
I do
community.
think one thing I did remember seeing in the email, sorry, I think Linkages to Learning is no longer going to pull some of the schools that are Linkages to Learning schools, they would go and pull all the families that are in their programs and they would serve them. So I think now that is definitely going to fall back on the providers to make sure that they're serving those families or making provision to serve them. That was one key thing I do remember from something I scanned looking at.
Okay, thanks, Pat. We have just about 5 minutes, but I know that we were also joined today by some providers who either hadn't been a part of this call before, or it may have been a really long time since you engaged in one of the calls. So if you just wanted to take a minute to unmute and say hello and introduce yourself. We always appreciate, knowing new members of the community and help along with some connections here. So happy to make a few minutes for that in our last few minutes here today.
Hi everyone, I can go. Sorry I'm not able to come off camera right now. But my name is Kelly Blackman. I am the outreach coordinator at Overflow City Church. And we have been doing a food distribution since 2020, I believe. We started with the Montgomery, or with the grant that the county gave. And then when that kind of fizzled out, we were able to continue on our own. And so Anne Marie connected us a couple weeks ago. And so this is our first time being here. So it was super helpful. Thank you guys for the presentations. It's super helpful to see so many people, also doing things in the community. I know it was there, but to be a part of something like this is so awesome. So thank you, Anne Marie, for connecting us. And I'm excited to keep coming. I see a question. We serve Silver Spring. So downtown Silver Spring. Four Corners area is really where we are.
Kelly, that is exactly where I live. So good to see you here. Thanks for joining us. Anyone else? I saw some folks earlier, maybe they had to leave already. Okay. And I'll just do one last quick plug that tomorrow night is the county executives community conversation happening in the downtown Silver Spring area at Veterans Plaza from 7 to 8:30. I plan on being there. Look forward to seeing those of you who may be planning to be there as well. So let's look out for each other. It'd be good to see you in person. If anyone has any other plans to attend future events, feel free to share that or to let us know in the future.